everyone, welcome to my YouTube channel Science Easy. Okay, today we are going to discuss about very important topic, that is Koch postulates. Okay, so we have in previous video we have seen about Louis Pasteur and Robert Koch, right? So today we are going to see about Koch postulates. So very important for examination. Okay, so we'll see actually in Koch postulates we have five different points or the segments. Okay, so to consider any microorganism as a causative agent, it should follow these conditions, or these conditions should be satisfied. Okay, first one is the bacterium should be constantly associated with the lesion of the disease. Okay, the bacterium means the causative agent should produce the lesion or the symptom of the disease. Okay, so the first point says that to say it as a causative agent, it should produce the symptom or the lesion. Second one, it should be possible to isolate the bacterium in pure culture from the lesion. Okay, means if you take specimen or the sample from the affected area, okay, from the lesion, we should be able to identify or isolate the bacterium in laboratory in pure culture form. Pure culture means the single colony of that particular bacteria we should be able to isolate. And the third point say that inoculation of such pure culture into suitable laboratory animal should reproduce lesion of the disease. So first point says that it should produce as the lesion or the symptom. Okay, from the infected area or from the symptom area you will take the sample. Second point say that you should be able to isolate the causative agent or the bacteria from that particular lesion. Okay, in third point it says that inoculation of such pure culture means you have grown in the laboratory or you have isolated that particular bacteria in the laboratory. If you introduce that particular sample or that particular pure culture, okay, what you got on the plate in the laboratory, so if you inject into the laboratory animal, it should produce as the lesion. Okay, so first point we said that the lesion of the disease should be there, right? So same lesion it should reproduced in the laboratory animal or the experimental animal when you inoculate pure culture. Okay, so fourth point says that it should be possible to re-isolate the bacterium in pure culture from the lesion produced in the experimental animal. Okay, so if you take sample from that particular infected animal, laboratory animal, so you should be able to re-isolate the bacterium. Second point, you isolate the bacterium, right, in second point from the patient sample. So you introduced that patient sample into laboratory animal in the third point, right? So fourth point says that you should be able to re-isolate, means same bacterium you should isolate from the animal also. There should be a correlation between the bacteria what you identified or what you isolated from the patient as well as in the experimental animal. Okay, fifth point is very important. Recently like initially it was 4 point, fifth point is recently added, that is specific antibody to the bacterium should be demonstrable in the serum of the patient suffering from the disease. Means if you consider bacterium as an antigen, so antibody should be there inside the patient's serum. It should be demonstrable, means if you take the serum of the patient, so you are able to, or qualitatively or quantitatively you are able to demonstrate the antibody. Okay, so these are the five postulates of Koch. Okay, this we call it as Koch postulates, very important for examination point of view. Thank you.